This is really a nursing channel. So I have one topic for you today. It's about the safety of giving the medication. So I'm excited. Let's roll on the intro. Before we continue, please subscribe to my channel and click that bell button for more interesting videos. So as a patient, or if you're in the hospital, you might wondering why the nurse always asks the name and asks the birthday or whatever that is in relation to that patient. And the reason for it is that the nurse wants to give it to the right patient. And sometimes people are kind of like impatient, and why are they asking me this all the time? It's because of safety of giving the medication. So here in the States, all the resources are available, especially if you're working in a hospital, and they have this thing called scanner. I forget the brand, but there's a lot of brands that they use. And what they do is that when you go to the hospital, especially in the ED, they're gonna admit you, and the most important thing that they're gonna do is that they're gonna put an armband, to the patient. There's a barcode in it. There's a MRN number, or it's a medical record number, and it's very important because when you go to your room in the hospital, they will ask you, and also they're gonna scan the armband that you have before they can give any medication. So there's a lot of instances that sometimes armbands are not working well, but mostly it has a lot of benefits, and it's making sure that the nurse is giving the medication to the right patient. I mentioned about a problem in relation to the armband, but it's usually on the account. Like for example, the patient arrived in the ED, and then later on the patient is transferred to the room. So that armband that they gave in the ED might not work. So in the department that is admitted, like for example a surgical area or whatever, some armband might not work. So the nurse will gonna provide a new one, and making sure that it's the right patient. So you're gonna ask the name again, birthday or whatever. Sometimes they ask the SSN number or the social security number, which the people here doesn't want to give, but at least there's a identification before they put the armband to the patient. But mostly, if it's being worn by the patient, it's usually the right patient. So there's always aside from asking the patient, that's kind of like a safety, additional safety for the patient before we can give any medications. And then a second one is that most of the hospital here, especially if the hospitals are accredited, like they're affiliated with some network, like for example like Hopkins, or if they're Mayo, so they have high standards. And the good thing about it, if they're affiliated with that organization, is that their level of services are really high. One example is that if you're gonna scan a medication, sometimes the medication in the computer will put something below the medication. For example, like this medication, you need to check if the patient is allergic to something, so each time you do a scan, and if there's a note below the medication, you have to make sure that you do it, because it's also for the safety of the patient. For example, the patient needs to be in PO for a couple of hours or something like that, and also aside from that one, hospitals are trying to make sure that there's less error on the medication. There are medications actually that has a similar name. So for example, you might wondering why a medication is stated in the computer, right? And then the capital letter is kind of like in the middle of the word, or sometimes the capital letter of the medication is in the first, or the what I call it, like the first letter, So they specify it because there's a similar medication, and then you would know and you would notice that, oh, this is a different medication, so this is not the right one, So they're trying their best, or they're trying to make a system that will prevent errors in the medication.
Another thing that they're adding also is that most of the hospital, or even the clinics, or even the nursing home, they have this Pyxis system. So it's kind of like a cabinet, and the pharmacy will put the medication in it, and then you cannot really open the drawer if you don't have the right patient, or you have to put the patient's name, and then if you have your list of your patient, and then that's kind of like the security, because you programmed it during your shift, so you cannot get any other medication except for your patients. One of the good thing about working here too is that the hospital is providing you with whatever materials that you can use in regards to medication. Like, for example, needles. They have a safety needle. They do surveys. They do questionnaires. So for example, they're providing you with a safety needle, and it's kind of like different, but then you have feedback, and you will say, hey, this is not good because there's a big risk of pricking yourself. So if they're getting a lot of complaints on that kind of medication, I mean, not medication but needle, they will change it. So there's always an improvement, which whatever they're ordering. So they're always providing you with the best materials that you can use in the hospital. Not just the medication itself, but also all the other aspects of nursing care. They can provide you with that laser that they put in the arms of the patient, and you can see the veins. So it's it's an additional. You can put the IVs in really easily because of that. So that's a good thing about it. It's kind of expensive, but if you're working in a big hospital, they can provide you with that machine or equipment.
One thing good about working here is that the hospital is providing you with a computer. So for example, you have a question, or you need to check something in the computer or in the internet, it's available always in the hospital. It has a safety programming. You cannot really open some other websites, because back in the day we used the books. You have to whatever that is needed to be done. If you're not sure of something, or you forgot something, you can see it in the books before, but now it's just in just a couple of clicks away. So all these things that I mentioned earlier, I experienced this in the hospital. But I'm not saying that every health facility here has it. I used to work in a nursing home, and they don't have the scanner. Not all of the nursing home has it. So what I did before is that I was working in a nursing home, and then they don't have the scanner. What they have is that they have a picture of a patient. So when I was through there, I was preparing the medication, the usual thing, checking the medication, the dose, the expiration date, and and then the last thing is that before you go to a room, you have to check the picture. And I can just imagine, when I was new there, I don't know the patient, I don't know what they look like. I have this picture here, so I bring the picture sometimes, and they look different, So like, oh my. So I have to ask somebody who worked there for a long time, and they will guide me, whoever this patient is, or Miss Adam or whatever. So it's crazy. So there's a risk there of making a mistake, you know. So there you go. So if you have a family member that needs to go to a facility, you know, that's one thing that you can check, you know, if they have a good system, if they have a scanner or whatever, you know, that's an additional safety you know, services that they can provide you if they don't have it. So, you know, it's your decision, but it would be nice if you see a facility that has it. It's additional.
So there you go. I hope I gave you some ideas with regards to the medication. And then this is a nursing channel. So if you have some questions, or if you need to know something about healthcare, just send a message there down in this channel, and then I will try my best to answer all the questions, and then maybe you'll give me an idea to focus on that and make a video, right? So thank you very much, and till next time.